Greetings all. As we are now approaching the finish line for HIV/AIDS epidemic, the line drawn at the year 2030, when AIDS would not be considered as a public health threat anymore, we have seen a positive progress in the reduction of the newly infected cases throughout the years. However, there are more to be done. In 2020, there are 1.5 million new cases of HIV infection worldwide, despite the emergence of oral PrEP as HIV prevention. The goal for the 2020 survey is to reduce that number down 3 times to 500,000 cases. This begs a question whether the same tools we are currently using as HIV prevention effective enough to end AIDS epidemic. And with the new and more effective PrEP, the injectable Cabotegravir coming up around the corner, we, the pro side, believe that it should be readily available as the first option for the people as a HIV prevention tool. And for today's debate, I would like to construct our cases into two main levels. The first one being the principal level, where I would discuss about how the clinical trials and the scientific data that suggest the superiority of CAP/LA comparing to oral PrEP. And the second one is the practical level, where Mr. Udom will be discussing the superiority of CAP/LA in the real-world setting. And without further ado, let's move on to my first argument, which is CAP/LA is currently the most effective PrEP available with more safety. According to HPDN-083, the clinical trial that compares the efficacies of CAP/LA to the daily oral TDF-FTC among MSM and TGW population, it is established that CAP/LA offers 66% reduction in incidence of HIV infection comparing to the oral TDF-FTC. The similar result was observed in HPDN-084, the clinical trial done in female participants, which shows 9-time reduction of HIV incidence in the CAP/LA arm. This information clearly stated the superiority in terms of HIV prevention for CAP/LA. However, the effectiveness is not the only concern when we talk about the product implementation. Safety is also the aspect needed to be discussed, which CAP/LA also shows prospect. In HPDN-083, it was established that oral TDF-FTC and CAP/LA are similar in terms of the adverse events. Surely enough, CAP/LA injections may expose clients to the injection site reactions such as pain and nodules. However, only 2.4% of those participants choose not to receive further injections as a result. This proves that CAP/LA is well tolerated in the majority of the clients. Moreover, CAP/LA is safer to the kidney comparing to oral TDF-FTC, which creates higher demand for users who deny using PrEP because they are afraid of the side effect on their kidneys and their bones. Not to mention how CAP/LA is the only PrEP choice for biological women with impaired kidney function, who cannot take either TDF-FTC or TAF-FTC as a HIV prevention tool. Another argument I would like to present is how the demand for CAP/LA is rising among the current PrEP users. According to IHRI site for HPDN-083, 97% of the participants in CAP/LA arm want to continue the injections, and 64% of those with the TDF-FTC arm want to switch from the oral TDF-FTC to the CAP/LA arm. Furthermore, a survey done in Tangerine Clinic, a clinic for transgender population in Bangkok, shown that 74% of the current PrEP users and 74.3% of the PrEP users who discontinue using PrEP want to receive CAP/LA injections. What this information entails to us is how current PrEP users are currently and constantly looking for new innovation for HIV prevention, preferably one that requires less adherence. So with all these reasons, it is reasonable to promote CAP/LA as the first option for the PrEP in the public health care setting, since its effectiveness and safety were proven better and the demand for it is soaring. And to put CAP/LA as the first option, we initiate discussions on how we can design services that suits the clients the most and ignite endless opportunities for new researchers to lead to the new ways we can deploy this new drug. For example, a variation in preparation and then how we can administrate this kind of drug into the clients. The pro side believes that CAP/LA can be an integral part in ending AIDS by 2030 if we put enough effort on the service deliveries and further development. Thank you.